Well, thanks, Mike, for this opportunity, and I appreciate the work of the Greater Manchester Chamber. You know, our business community in New Hampshire has proven innovative and resilient, but there are significant challenges that lie ahead, especially through these tough winter months. And the impact on our economy is uneven. We see some folks that are adjusting, are doing okay, but other sectors of our economy that are really struggling right now. So I think that the efforts to pass bipartisan legislation for bipartisan bills back in the spring was really significant. It pushed out a lot of resources that helped provide a financial lifeline to our local businesses, our hospitals, our communities to help weather this storm. And that's where our focus should be, on how we can redouble and refine these efforts. We know that they weren't perfect. And the feedback that I got from businesses across our state in March and April was really important to allow us to advocate for legislation that could refine the Paycheck Protection Program in particular. We not only got more resources out, we got it out through CDFIs and local credit unions to target our smallest businesses, and we made sure that the terms of the program were more flexible. We need a second round there to make sure that we can provide additional support for those who need that additional help moving forward. But the Federal Reserve Chair continues to tell us that the risk of Congress going too small is really great. They want to see us go big, and we've got to look at these expenditures as one-time expenses to get our economy up and running again. Now, we can't lose sight of the public health aspect of this either. And I think that's where the administration has fallen short, not trusting the scientists and ensuring that we're doing everything we can to have a national testing strategy. We've done better here in New Hampshire because I think people have been a lot more serious about the steps that we all need to take to keep people safe. But we can't just get complacent. We've got to stay vigilant, especially through these tough winter months, to keep these numbers low. That's going to allow us to not only head off a second hit to our economy, but ensure that our businesses can remain open. So we've got to get to a bipartisan deal. There are a lot of facets that are on the table of that deal, and I won't be satisfied till we get more help over the finish line.
Sure. Well, thanks, Mike. And it's impacted all of us, right? I know in the outset, my wife, Cassie, and I were just doing what a lot of folks were trying to do, which is help our neighbors, work with small businesses to, stay going during all the closures and all of that. So really important. I've actually worked on these issues before, though. I was chief of staff to Dr. Deborah Birx, who we all now know is the coronavirus coordinator. But she and I and Dr. Fauci at the time were implementing our global HIV program, which actually was another time when we didn't think we could take on a tackleable pandemic, and yet we were able to do it by bringing American ingenuity and the private sector in. I think we can learn some of the lessons from that and apply it to now. And so when you look at the federal response, we need to continue to invest in ramping up of testing. It was great that just last week it was announced that first responders in New Hampshire actually now have access to rapid testing. We need to make that more readily available for other key areas, including the private sector, because you have some core supply chain areas that need access to rapid testing so we can get people back to work in a way that's healthy and safe. So that's one piece. We need to continue to invest in therapies and therapeutics. And it's really great that the FDA is continuing to focus on this, whether it's by rapidly moving forward approvals for a lot of new therapies, including Regeneron and others. We also need to continue to invest in a safe, effective, reliable vaccine. I think we're going to continue to be looking at a similar circumstance that we are in right now until we have that vaccine. So it's really important that we continue to move there in a safe, but also a speedy process. Mm-hmm. And then when we're looking at the other areas of the response, we need to reopen the ability for small businesses to get Paycheck Protection Program funding. There's over $100 billion right now that's already been appropriated by Congress that's sitting there unutilized and unavailable for small businesses. The only reason it hasn't reopened for small businesses is politics. I think that's really where Congress has failed us right now. They put other political agendas into play instead of just trying to deliver for hardworking middle-class families and small businesses here in New Hampshire and around our country. They could take a standalone vote on the Paycheck Protection Program right now today if they wanted to. There's something called a discharge petition on the on the floor of the House of Representatives. Any member could sign that on their own free will. Unfortunately, right now, it hasn't been done in a bipartisan way because the Speaker of the House isn't allowing her caucus to sign that. So we could have a vote on that today. We could open up more Paycheck Protection Program funding and it could be available to small businesses tomorrow if we wanted to, if Congress was willing to put politics aside and deliver for people. And so I think that's one small piece. We also need to, of course, I'm a close ally of Governor Sununu's. He's a good supporter of my campaign. He needs an ally down in D.C. to continue to fight for relief, both at the state and local level, and then also make sure that we're continuing to put forth good ideas that foster economic growth in a way that we know how to do it here in New Hampshire.
The relief efforts have been really helpful to our airport, to Manchester Transit and other local transit agencies across our state. They're dealing with fewer riders, lower revenues, and so we've got to make sure that we don't see either air or bus routes disappearing as a result of COVID, because we're going to need that service once the economy is back at full tilt. So any additional legislation needs to provide that direct support. But really, the conversation around transportation and infrastructure to date has really only been about how do we manage the experience we're going through. We've got to talk about how we put people back to work. And that's why I asked for a position on the House Transportation Infrastructure Committee. We've worked for the past 2 years developing legislation that actually passed the House back in June. Unfortunately, it appears there's only so much oxygen in Washington right now to deal with these things, and we did a short-term reauthorization of highway funding. But our bill would increase highway funding by 30%. That means more projects could be addressed here in New Hampshire and across the country. It provides significant additional support for new passenger rail routes, so that could really help us identify the federal sources we need to get the Capital Corridor project off the ground, which would be an economic game changer for central and southern New Hampshire. And I also have a provision in the bill that would create a new grant program for bike and pedestrian infrastructure. So I think we really need to look at all modes. This is an opportunity where not only can we stimulate the economy and put people back to work, but we can rebuild for the future, do it in a cleaner and greener way, and do it in a way that creates community connections. One of the things that the Chamber has focused so much on is our aging workforce, and how do we attract the young professionals we need to be taking jobs and putting down roots here in New Hampshire. Transportation is such a crucial component of that, and making sure that we have community amenities, including walkable, bikeable communities, is so important. And that's what we can accomplish through an infrastructure package. I'm hopeful we'll get there in January if the stars align.
Well, look, I'd want to work hand in hand with Governor Sununu on his 10-year transportation plan as well. I mean, there are certain priorities that have some level of federal funding, but I think we could get more. You probably have, the exit in Londonderry 4A off of 93, which is a key area that we need, especially as we're continuing to support. I think you are going to see some support for the airline industry from any sort of new COVID-19 relief package. If that's done, I think you're going to see an uptick in the expansion of services out of the Manchester airport again, which is important, right? I mean, that is a key hub of our economy right now. And it's really important that we continue to expand flight patterns from Manchester, because right now they have cut back because of a cutback in travel. I'm hopeful that, especially by the spring, you're going to see an uptick in travel again, and we need to make sure that we have Manchester Regional Airport supported so that's ready for that. That's a key thing. Working with Governor Sununu, like I said, on his 10-year transportation plan, and then working to support additional measures that are needed for that, making sure we're fighting for federal funding. In a way also, by the way, that approaches a new way to go about it. I mean, right now, the regulations in place to make a project shovel-ready is onerous, it's cumbersome, and it doesn't even make sense, right? It looks like it was designed on a whiteboard in some windowless conference room in D.C. by folks who have never actually held a shovel in their hands. We really need to have a lot more public input into these processes. We need to streamline them. And also, there's a lot of interest right now from the private sector in co-investing in some of these programs as well. That's something else we can do if we have people with kind of a forward-looking insight into all of this in order to bring these projects about.
Well, first, we have to address the high cost of education, higher education in New Hampshire. We provide the least amount of state support for our public university system, and that means a lot of young people go out of state to go to college, and then they start their careers and start their families in other places. We want to keep them right here in New Hampshire. So we've got to address the issue of affordability around higher education. I think we should be bringing down student loan rates and expanding Pell Grants to make sure that college is more affordable. And it's going to take the partnership of the state of New Hampshire to really ensure that our university system is well-funded, is attractive to in-state students. In addition to that, we have to work on the pipelines. And I've been touring a lot of manufacturers lately. Workforce challenges are as significant as they were even before this pandemic. In some instances, they've gotten worse because our manufacturers are ramping up production of critical supplies that we all need, but they don't have the workers to meet the demand. So it's important that we work through our high schools and career and technical education programs and our community colleges to create those pipelines. I'm supporting legislation that would invest $200 million in CTE programs and Perkins grants to make sure that we're seeing the cultural change we need to encourage people to go into the trades, to go into career and technical education, to get a degree at a community college and get right into the workforce. There are lucrative careers that people can pursue in manufacturing, in the trades, and other critical areas in our state. And we just really need to open the doors to our student population and make sure there's a warm handoff into the workforce right here in New Hampshire.
Well, so there's two different things. One very specific for a sector, and then I think one that's a little broader. First and foremost, I think we have a unique opportunity because of COVID-19 and what we've learned to bring a lot of manufacturing from China here to the United States, especially in some core areas, pharmaceutical manufacturing development, PPE production, of course. Also, I think some key national security components that we rely on manufactured parts from China can be made here in the United States. I've had conversations with a lot of these folks who run these companies who are interested in bringing that manufacturing here to New England and potentially to New Hampshire. In fact, we've already been working with some of those companies to get them here to New Hampshire. I think that could be spur a whole new sector of growth for our region. That would be good, high-tech, high-paying jobs. That would be good for a lot of new college graduates. That would attract a lot of young workers and improve the workforce here so that they have economic opportunities when they do graduate from school. So that's one piece. I think the other piece we need to do is work hand in hand with our higher education institutions so that they're providing additional development of programs that tie in with the sectors of the economy that we have here in New Hampshire. I think one of that will be biotech development. If we can work in partnership with them, I've talked to the folks who run the Pease International Trade Port, as well as other folks who run a lot of other areas in different companies in New Hampshire. If they had that partnership with whether it's University of New Hampshire, whether it's Southern New Hampshire University, there's so many different opportunities that are working in partnership between higher education and the private sector that I think we can have a pipeline from schooling to economic opportunities that will keep a lot of young people here in New Hampshire. And that's so important. And we are seeing a lot of that happen right now in downtown Manchester. Because of the redevelopment of the mills, so many job opportunities now exist that 10 years ago, none of us could have even dreamed of, really.
Well, I think we should build on the Affordable Care Act. I think the essential benefits and the coverage that's protected under the ACA is really bedrock, and we should be moving beyond the political debate to focus on costs. And I think about this as someone who was an employer in Manchester and a chamber member, a restaurant owner. I know that my employees were more productive because they had access to the care that they needed. And we offered it long before the ACA came along because it was the right thing to do. And I think as a country, we're seeing through this pandemic that our health and well-being is all interconnected. And so making sure that someone gets vaccinated, that someone gets the care and treatment they need is not only more efficient and less costly for our healthcare system, but we're better off as a community as a result. So I think we really should focus on how we can build on the Affordable Care Act. We repealed some healthcare taxes this year that should help stabilize the cost of insurance. We repealed the health insurance tax as well as the tax on Cadillac insurance plans. That was an important bipartisan step we took. We've also been working on legislation in the House to create a reinsurance pool, which could help make exchange products more affordable here in New Hampshire. And I do support adding a public option to the exchanges. I think that would be good for people who are on the individual market and could shop for additional plans. We also have to recognize that the cost of prescription drugs is a significant driver in the healthcare space. And we've got to make sure that we're negotiating with the drug companies to bring down the cost of prescription drugs. I think that's a common sense idea. We were able to pass it in the House this past year, but it remained stalled in the Senate. So I think we should be looking at costs, both of premiums and also prescription drugs, as a way to make sure that healthcare isn't out of reach for so many folks in our state. We benefit from people having care, and that's why I led the effort in New Hampshire to help pass Medicaid expansion and to implement it. I think that's working for us. Repealing the ACA would go back in the wrong direction, would also get rid of substance use disorder coverage that people rely on. And at a point in time where we're still experiencing an addiction epidemic, we can't afford to see that happen.
Yeah, well, it's a hugely important issue, in large part because passage of the ACA has led to some of the largest premium increases we've ever seen. You know, I was talking to a woman just the other day from Greenland who, for the first time in her life, was unemployed. And so she started her own sole proprietorship. She went out shopping to find a new healthcare plan. The best healthcare plan she could find was a $500 a month high deductible plan. That 6 years ago would have cost half that much. We need to be looking for a replacement if Obamacare is repealed. I do think Obamacare has not led to the outcomes that those who voted for it desired. It has led to higher premium increases. It has led to a lot of folks losing their health care plans, especially in a state like New Hampshire, which has a relatively limited number of insurers. What we need to be doing, though, in that replacement is by individualizing health care, making it easier for small businesses to afford health care. Now, I came back from a late day on the campaign trail a couple weeks ago, stopped off at T-Bone's about a couple miles down the road from my house, sitting at the bar having a bite to eat, restaurant's closing up, I go to pay, a couple young people walk by me. It's 10 o'clock at night, but they said, do you mind if we ask you a question? And they were small business owners. One of them owned an Apple iPhone repair business. They said the biggest challenge we have is keeping employees because we lose them to bigger companies because we just can't afford to provide the health care and health insurance that they can get elsewhere. It's one of the reasons I support giving tax incentives to small businesses so that they can either give a direct healthcare credit or provide a larger and more comprehensive healthcare plan to their employees. It's the reason why I support increasing tax deductibility of health savings accounts so individuals, tax-free, invest more in their own healthcare outcomes, whether it's for routine healthcare costs or for catastrophic instances. It has to be easier for small businesses to pool their resources for association and community healthcare plans. Those are ways that will also drive down costs. And all of that can be done at a time while we drive down the overall cost of healthcare. We need price transparency. We need to end surprise medical billing. And there's a whole host of other things we can do that actually drives down the cost of healthcare, which will ultimately drive down insurance costs as well.
You asked that question because that's the only way we're going to overcome our challenges. You know, the only way to get COVID relief passed right now is to do it in a bipartisan way by bringing people together. We were able to do that last spring. Unfortunately, politics is getting in the way of getting something over the finish line right now. And so we need folks that are rooted in their communities who understand that here in New Hampshire, we can come together and solve problems. It's sometimes a lot harder in Washington. The work that I've been doing for our veterans on infrastructure, on the environment, on healthcare has largely been bipartisan. In fact, of the 33 bills that I've written and introduced, a majority of those 17 were introduced with Republican co-sponsors. I always look to find someone to work with across the aisle because, number one, you have a better chance of passing it, and number two, you make the bill better. I've worked for our veterans and chair the subcommittee on oversight with a guy who's a retired general. He chaired the subcommittee last time. And when we're working on issues, whether it's whistleblowers or care for our veterans on that subcommittee, there's no difference between us. And that's really the way it should be on the issues of the day. So I do hope we can find our footing and our sense of common purpose as a nation. It involves understanding who the other person is that you're dealing with, where they come from, and the fact that you have a lot in common. And I think that's what people are looking for. Unfortunately, we see a lot of negative attacks, including in my campaign. I'm going to be focused on how we can actually move the ball forward and get some things done. And I'm always much more focused on what's left to do as opposed to what we've already accomplished. And also very focused on the type of constituent service we can offer people. You know, even in a divided climate where you might not be able to see eye to eye on legislation, if you can help someone in a very personal way, that's what public service should be all about. And that's where my focus is going to be the next 2 years.
Sure, and it's so important. I mean, it's something I've done. You know, when I was in the State Department, when I was helping lead our global health office, we actually had to get our global HIV/AIDS program reauthorized. A lot of folks said, don't bother, just let it get funded. Don't worry about the authorization. We just didn't think that was the right way to run a program. So we brought a liberal Democrat and a conservative Republican together, and we got it done, and we did it unanimously 3 days before Congress adjourned because we believed in the goodness of the program. We brought people together to be able to see the best of it. So whether it's issues like that, whether it's working in a bipartisan way with our own delegation here to tackle our drug addiction challenges, whether it's working with a bipartisan delegation in New England to protect the Portsmouth Naval Shipyard, there's a lot of things we can do if we work together, as long as we put our both best interests forward. Doesn't mean we agree all the time. That's not how our system is set up, right? There's going to be times when it's a little disagreeable, but it doesn't mean that we can't get things done on behalf of the people we serve every day. And that's why I'm looking to go down to Washington, D.C. and get done. Plus, I have a track record of getting that done.